you. I see a last question here from Tom, which I think is a good one, maybe to close, because it brings you back to the reason of being of Andaman7. So to you, Vincent, the question is the push towards patient-centric data ownership model. Will it happen or not? And what will drive this? Why are we convinced this will become the new norm?
Well, I cannot read the future, but I sure hope that it will happen. I see very strong trends, right? The patient empowerment movement and the request for patients to have all of their data is something real and very strong. Of course, not all patients want that, but a large number of patients want that. Suffice it to say that, or to realize that patients look on Google, on Wikipedia for information, which is not always a good idea. It has to be commented by doctors, but at least it shows that patients are looking for information and they want information. I can tell you that in my own case, and when my son Pierre was diagnosed with bone cancer, as parents, we were really looking for information and we wanted to have the best information. And we were also asking the doctors to verify that information. So it's not just pushing the doctors out. It's not at all about this. Doctors have a very important role, but the patient also has or the carer or caregiver of the patients, or the spouse or the close ones, also have a very have a great importance, because they can collect the data as a hub, and they can transmit the data from one doctor to another, and make sure that everybody is concerned and well informed of the problem. So I really think that that it's changing on that point, that patients are being empowered. I also think that very good doctors wants that. For example, when my son was diagnosed with Ewing sarcoma, which is a pretty rare sickness, the doctor was very open and was even asking us or agreeing with us to ask for second advice. So we went to another hospital in another country, even in Paris, and our oncologist gave us all the details to share with the other oncologists, because they wanted to make sure that the diagnostic was good, which was critical, because for cancer, obviously, you have to go extremely fast and apply the best treatment as soon as possible. So if you make a wrong diagnosis, then it's a very significant problem, right? So in that case, the doctors were very open to have a second advice too. So I don't think that there's another way around than going forward in that direction. I think it will happen gradually, of course, and it's faster with some doctors and with others. But yeah, it's obvious. We are all working for the health of patients, right? Doctors, but also research and pharma companies. There's one goal, right? To improve health for every patient. So it has to go that way, I think.